I want to talk a little bit more about still life. And again, I'll go through this a little quickly. Um, for me, if you're going to use PRF and go through all the steps to use PRF, you can't use chlorhexidine. Why would I put a solid PRF on the external side of my socket graft or anything, and then I'm going to use something that's cytotoxic that's going to kill off all my cells? It's just, it doesn't go hand in hand. And a lot of clinicians at these trainings and a lot of patients were asking me, what's in still life? And I kind of felt dumb when I didn't have an answer for them. So we did this review on, all the active ingredients in still life and how they apply to still life. Okay, so there's 16 active ingredients. I'm just going to talk about the first three that stick out for me so that you can share this knowledge with your patients. And whenever someone says there's not enough research on still life, these active ingredients have thousands and thousands of research articles on them alone. So there may be a few papers on still life in combination of all the active ingredients in culmination together, but you know, each active ingredient individually has a lot of research behind it. Azadirachta indica has been used in ancient Indian medicine. It's also known as neem. And one of the nicknames for it is village pharmacy because there's so many different uses for it. And it was actually named the tree of the 21st century by the United Nations in 2017. So you can see there's over 300 phytochemicals that you can derive from neem, and it's actually being researched to be used in cancer, anti-cancer drugs, because cancer is a very complex disease that disrupts a lot of different pathways. So you need something that will also disrupt a lot of different pathways, like neem that has a lot of phytochemicals and can interrupt a lot of pathways in the body and positively affect them. And if you look in the literature, this is a study by Botelho where neem outperformed chlorhexidine alone. So rinse with neem alone outperformed chlorhexidine when comparing its use on patients with gingivitis. Um, and it also helps to inhibit um, pro-inflammatory cytokines like TNF alpha, IL-1, and IL-6. And if there's any periodontists here, or anyone that's well studied in perio, you know that these are key pro-inflammatory cytokines that contribute to periodontal disease. Plantago has been used to treat burns, and it also helps with patients' pain, and it helps with fibroblast proliferation. So you can appreciate the use of Cell Life and its key ingredient Plantago and its contribution to healing on secondary intention, similar to PRF. If you observe healing on secondary intention, you can appreciate it. And the way that they test this is they have a scratch wound assay where they have a dish of fibroblasts, they make a fake wound in it, and they see how fast the fibroblasts close that space that was created. And one of the studies that Dr. Myron showed actually demonstrated that this property in Plantago has been maintained in still life. And then Arnica montana has been shown to convert macrophages to their M2 wound healing phenotype. Okay, and it also inhibits the same pro-inflammatory cytokines, TNF alpha, IL-1, IL-6, and that's really a key theme in all these active ingredients, and also the fact that they're all antimicrobial as well. If you talk about why Still Life, okay, and everybody on the Still Life team is very passionate about this. The opioid crisis in the U.S. is pretty severe. 25% of patients that get prescribed opioids end up misusing them, and it only takes 5 to 7 days to develop a physical addiction to opioids. That's something that stands out to me that I think about anytime I want to prescribe my patients some type of opioid or some stronger pain medication. It only takes 5 to 7 days, and the amount of overdoses and deaths contributed to opioids have quadrupled in the United States. In parallel with the increase in amount that we've been prescribing. I'm sure a lot of you know someone that struggles with opioid addiction, and a lot of times it happens from, I had my wisdom teeth taken out, and I got addicted to opioids from that. I have one of my one of my close friends who has that same story. And so the way that Stella Life works is through preemptive analgesia, which I think is very genius. So if you get a cut on your hand, what happens is you have a release of pro-inflammatory cytokines and a signal that transmits from your peripheral nervous system to your central nervous system. So all these active ingredients are anti-inflammatory, and what they'll do is they'll mitigate that signal. So you'll start applying the Stella Life gel preemptively, okay? And we can do this as surgeons because we know exactly where the wound is going to be. So if we apply it preemptively 3 days before, and then we make our incision, the pro-inflammatory cytokine release is lessened, and the signal from the peripheral nervous system to the central nervous system is lessened. The patients perceive less pain. And there's been some studies to document this. Okay, this is a study by Lee and Suzuki where they did block grafting ridge augmentations, which is one of the more painful surgeries. And the patients were prescribed, they were either in an opioid group or non-opioid group and were given Stella Life and over-the-counter drugs. And the non-opioid group outperformed the Stella Life, or excuse me, the Stella Life and non-opioid group outperformed the opioid group at every single time interval, which is pretty amazing. The more that I use Stella Life and the more that I talk with clinicians about Stella Life, the more I see uses for it. It's being used in lichen planus, oral mucositis, obviously in perio. I've had a few patients that have reported it's helped them with burning mouth syndrome. I've had a few patients that said it didn't, but we're finding more and more uses for it, and there's a strong need for more research on Stella Life and what it can do, what its limits are. Okay, and here's a study by Kotsakis's group with Mike Picos, the cytocompatibility properties of an herbal compound in vitro wound healing. So what they wanted to do was evaluate the cytocompatibility of chlorhexidine and compare it to Stella Life. And this is a zombie red dye that stains all the dead cells red. And you can see at 10% dilution of chlorhexidine, look how many red dead cells there are compared to 40% dilution of Stella Life, barely any. Okay, and here's that scratch wound to say that I was talking about. You can see Stella Life actually helped with fibroblast proliferation compared to chlorhexidine. There's actually no movement of fibroblasts at all, and compare with the control group. So I'm just going to go through some case examples, okay, and I'll go through it very quickly because I know it's getting late. Here you can see our free gingival graft, sutureless at 2 weeks, very mature healing with Stella Life. Here's another large mandibular free gingival graft, PRF suture to the palate, and at 2 weeks, very mature healing. Okay, and this is an interesting case. This patient had an FPD from 21 to 28. Okay, so had a big intrabony defect at 22. All right, and the very convenient treatment plan was to just resect the root of number 22 and leave the bridge intact. Okay, so after cleaning out the defect, packed our sticky bone in solid PRF and sutured, and this is actually only 2 days later. So I saw the patient in the waiting room. She was in the waiting room for her husband who was getting treatment. I asked her how it was, and she acted like it was just a normal dental appointment, like she had just had a filling or something, and because of PRF and Stella Life, this 2 days looks remarkable. And then here we have our 2 week healing. Okay. And then here's just, very straightforward implants at sites 5 and 6, but look at the incision line. This is a case where no PRF was used, just Stella Life, and the incision line looks very mature. And this is probably the case that really made me a believer in Stella Life and what prompted me to write that article and that review article. Here I have a ridge augmentation, and this is early on. I was probably only 6 months out of school. And at 2 weeks, we had a soft tissue dehiscence after my GBR. So you can see that, my bites are too shallow on the lingual. It ends up opening up, and I told the patient, we're probably going to lose the bone graft and we'll redo the case. And she was like, please, I really don't want to go through this again. Is there anything that you can do, anything at all? And I was like, well, at my other office, we use this rinse called Life, and it's supposed to help with healing, fibroblast proliferation, etc. I was like, you can try it, but I still think we're going to redo the graft. So she ended up ordering Life online, and 2 weeks later, we had complete closure of the soft tissue dehiscence. And I was just like, wow, like this was amazing. Like no PRF, nothing, just Life. And we had complete closure. So since then I reached out to a few colleagues to get together cases like this. You obviously don't plan for, membrane exposure during GBR, but we've got about 6 cases so far with 100% resolution using just Life alone. And Dr. Myron does a lot with PRF and facial aesthetics, and this is Debbie Duraco. She's a Life rep, and she applied Life to just half her face. You can probably guess which half is healing faster, and that's, obviously the Life side where she's just applying the gel, and
after every procedure,
I pretty much do it after every surgery. I have a tube of Life gel that I'm applying immediately after. Um, every post-op, my assistants are applying the gel. We love it. It's precious to us. Okay, so all these procedures work: connective tissue grafting, free gingival grafting, implant sinuses. But we should still strive to improve on reducing post-operative pain and healing time. And Still Life helps us accomplish these goals. So in summary, Still Life is a great adjunct to pain management and helps reduce opioid prescription in your office. And Still Life is selectively cytotoxic. We should aim to be antimicrobial and kill off the bad bacteria without killing our own cells in the process. So a lot of good research coming out on Still Life. I've been using the tooth desensitizing paste, and patients have loved it so far. That's all I have for you guys. If you're interested in the in-office training or for more information on my cases or just any question at all, this is my cell phone number and email address, and just get in touch with me.